from Kitchener-Waterloo.
Thank you very much, Mr. Speaker. My question is to the Acting Premier. It is Mental Health Week in Ontario, and less than 6 months ago, Ontario's Auditor General delivered a scathing report against this government's non-record on children's mental health. She found that youth mental health agencies in Ontario have been overwhelmed by 50% spike in hospitalization cases since 2009. She also found that this Liberal government had not analyzed the reasons behind the increase or taken steps to address it. Mental health issues and illnesses account for more than $6 billion in lost productivity costs every year, but this Liberal government has decided not to make mental health a priority. Why doesn't the Acting Premier and this government understand that by denying mental health supports for children and youth, it compromises their ability to reach their potential in school and in the world of work, and often has devastating results for families in this province?
Thank you.
Thank you, Speaker. And I will take the first question and refer the supplementary to the Minister of Children and Youth Services. Minister of Health and Long-Term Care and I this morning were at the University of Toronto, where we made a very important funding announcement to support mental health services in our post-secondary institutions, in our colleges and in our universities. Speaker, we announced an additional $6 million a year on top of the $9 million base funding, Speaker, to bring to $15 million a year the supports on campus. That's a very important part of our mental health strategy to make sure that students can get access to the supports they need when and where they need those supports, Speaker. We are moving forward on supporting mental health for children and youth, and I know the Minister of Children and Youth will want to speak to the supplementary.
The wait lists in this province are the norm, and that's the sad truth. Ontario is facing a mental health crisis. CHIMO cites wait lists of 1.5 years for service. Most kids end up in a hospital only to be discharged and find that they have to wait again for services in their community. Advocates say that $118 million is needed immediately to expand treatment and make it available early. They say the system is in crisis, even if you won't acknowledge it. Between 2006 and 2016, emergency department visits by children and youth seeking help for mental health or substance abuse increased by 63%. Hospitalizations were up by 67%. And according to Children's Mental Health Ontario, they say, and I quote, "Our current mental health system is not meeting the needs of children, youth and families." Speaker, the government knew all of this and did nothing. My question is to the Acting Premier, why?
Thank you.
To the Minister of Children and Youth Services.
Minister of Children and Youth Services.
Thank you, Mr. Speaker, and I'd like to thank the member for the question. There's no question in my mind, Mr. Speaker, that there is more that needs to be done to help young people in this province when it comes to mental health. Over the last couple of years, we've worked with the sector, with advocates, with families, with young people, to look for ways to build a strategy that's going to be right for Ontario. And we've come up with the Moving on Mental Health strategy, and I actually met with advocates this week here in the legislature, and I made a commitment that we would bring forward a strategy very shortly based on the input we've received across the province, and to really build system change that I believe is necessary in this province. There are areas where we see some overlap. There are areas where we see gaps. My job is to make sure that with so much change taking place in mental health here in the province of Ontario and the demand that continues to increase, I need to make sure that we're not set up for change just for 1 or 2 years, but for 10, 20 years forward.
Thank you. Your question, the member